A new study this week found evidence against the theory leading the anti-vax movement. The decades-long study shows there is no connection between the measles, mumps, rubella vaccination and autism. Scientists researched 500,000 people over the course of 10 years for this study. Here to discuss the breakthrough is Dr. Jen Caudill, a family physician and associate professor at Rowan University. Dr. Caudill, thank you so much for being on the show again.
Thanks for having me.
So tell us, what is the history behind the MMR vaccine and autism?
Yeah, so first of all, let me just put it out there. Vaccines do not cause autism. The MMR vaccine does not cause autism either in particular. The history is a really interesting one. Back in 1998, a man named Andrew Wakefield, he was a British physician at the time, he published a study in a major medical journal called The Lancet, connecting the MMR vaccine with autism. It was a small study. It wasn't well done. It's not a good study. And The Lancet retracted the study because of this. He was also stripped of his medical license, Andrew Wakefield. But the result has been this sort of perpetual myth that the MMR vaccine causes autism. And that's what we're still dealing with today.
So, Dr. Caudle, first tell us what a huge breakthrough this may be for the medical community and for parents. And also, how did the study disprove that theory, and what are the effects of this vaccine in its actuality?
Absolutely. Well, so first of all, this is actually not the first study that has disproven the connection, the false connection between the MMR vaccine and autism. There have actually been dozens of studies done over the years. This has been disproven over and over and over again. What's exciting is that this is another study. It's a very large study. You mentioned almost 500,000 people. It's actually over 600,000 children that were studied. And once again, showed the children who received, this was done overseas, children who received the MMR vaccine did not have an increased risk for getting autism. And that was among different groups of children, different scenarios, et cetera. What this does is it adds to our fund of knowledge that we have that MMR vaccine and others don't cause autism. Unfortunately, we have to keep saying this over and over and over again. But I'm happy to do it. And I'm also happy to see that we have another study that yet confirms this again.
The movement against vaccines is gaining traction, Dr. Caudle. You know this better than I do. One teen even testified on Capitol Hill about the dangers of misinformation online. He defied his mother's wishes to avoid a vaccination. Here's what he had to say for our viewers.
I approached my mother numerous times trying to explain that vaccines are safe and that my family should be vaccinated. Approaching even with articles from the CDC, explicitly claiming that ideas that vaccines cause autism and extremely dangerous consequences were incorrect. In one such instance where I approached my mother with information from the CDC that claimed vaccines do not cause autism, she responded with, "That's what they want you to think."
So, Dr. Caudle, first, have you heard parents say that to you? Like, that's what the CDC wants us to think? You have.
Absolutely.
Is this, so this is more common than we would imagine?
It is so common. And first, let me just say how brave that child is. And I'm giving him a virtual thank you for being so brave and standing up. As a family doctor, I hear this all the time. I hear this with flu vaccines. I hear this with other vaccines. I hear it from parents who are reluctant to give their children vaccines. This is huge. And this is something as primary caregivers, whether you're pediatrics or internal medicine or family medicine like myself, we hear all the time. I am always, and again, I will do this till the end if I need to, but we are always talking about and trying to refute the myths that are out there. There is a lot of fake news and fake health news. There's a lot of conspiracy theories running out there on the internet, et cetera. I just have to say it over and over and over again that the idea between vaccines causing autism, that is false. It's not a government conspiracy. It is false.
But I have to ask, how do you and the rest of the medical community convince these anti-vaxxers to change their minds?
Yeah. So honestly, sometimes we're not able to. I'll be very honest with you. I explain the data. I will give written information. I'll give evidence-based websites. I'll talk about the risks. Remember, measles, mumps, and rubella, for example, we're seeing an upsurge of measles cases throughout the country. I think people forget that before we had this vaccine, people died from complications of the measles. How soon we forget. So these are things that I'm always talking about. But remember the flip side. There are offices that actually will not see patients who refuse to get vaccinated. There's another side of this too, because physicians, we often know the harm. If a child with measles comes and sits in the waiting room and there are little babies who are too young to be vaccinated, we know that that's a public health risk. And there are some physicians who have literally chosen to not accept patients who refuse to get vaccinated. There are a lot of sides to this story, but one thing that I do to answer your question again is educate, educate, educate. And I just don't stop. Every time I see the parent, every time I see the child, I try to bring up the conversation and also to understand what the concerns are and really what the hesitancy is. That's really important.
All right, Dr. Caudle, let's move on to other medical news that a lot of people are talking about. Last night, we learned Jeopardy host Alex Trebek has stage 4 pancreatic cancer. Now tell us, doctor, how serious is that? And is it treatable? Because we heard the host say, you know, the statistics aren't great for survival.
Right. So, you know, our hearts and prayers go out to Alex Trebek, and you know, he's such a fixture in our daily lives. Pancreatic cancer is a tough one. I'll be very honest with you. And one of the reasons why is because of where the pancreas is noted, or whether it's located rather in the body. It sits behind the stomach and in front of the spine. And what that means is it's kind of buried in our abdomens. It's hard to reach. And what that means for doctors is that if tumors were growing on the pancreas or if it were changing, et cetera, we may not actually be able to feel it if we were doing a physical exam. Now, the other thing is that with the pancreas and pancreatic cancer, oftentimes symptoms are vague if patients have them at all. And oftentimes, if they do have symptoms, we may not diagnose pancreatic cancer until it's very late. So for those reasons, it can be very, very tough. And yes, there are treatments, chemotherapy, surgery, radiation, et cetera. But this is a very tough condition. It really is.
Well, what do you do? I was hearing this morning. I was doing some research. When there are no symptoms, I mean, how can you possibly diagnose something like this, even if you have your regular physicals with your doctor?
Honestly, sometimes it's not diagnosed, right? Sometimes we can't diagnose it. Sometimes it's not seen. And, you know, it's one of the things that speaks to the fact that medicine is not a perfect science. You know, this is what I would say to people out there, because I don't want people to be afraid. This is even more of a reason for us to listen to our bodies. You know, anything that doesn't make sense. Sometimes symptoms or signs could be vague abdominal pain, or weight loss that you can't explain, or maybe a yellowing of the skin. Obviously, sometimes those symptoms don't happen. But I say to everyone out there, if you notice something that's going on with your body that you can't explain, make sure you see your doctor for it. Make sure you get an answer and an explanation. But yes, sometimes this really, really is tough. And, you know, we're all pulling for Alex. We really are.
We certainly are. Dr. Caudle, thank you so much for being on the show. Such useful information. Always a pleasure when you're on. Thanks for being here.
Thank you.